Did you know there's one simple habit that can protect your heart, lower your blood pressure, and help you sleep better all at the same time? At a stage in life where energy levels dip and every doctor visit seems to add more pills to the list, there's still something powerful you can do right from your living room. No gym, no equipment, no leaving the house. In fact, it might just be the best kept secret your doctor never mentioned. If you're between 55 and 80, you've probably noticed your body responding differently to stress, food, and especially movement. Maybe your blood pressure doesn't bounce back like it used to, where you wake up at night feeling restless. You might even worry more about your heart. But here's the good news. It doesn't have to stay that way. Today, I'll show you 5 simple, doctor-approved exercises that older adults can use to improve heart health, reduce blood pressure naturally, and feel more steady and in control, all without overexertion. So, grab a sturdy chair, clear a little space, and stay with me until the end. You might be surprised by how much control you still have over your heart and health, no matter your age. Exercise 1, brisk walking. Let's talk about one of the most underrated, yet incredibly powerful ways to support your heart health, brisk walking. It might not sound like much at first, but for adults in their 60s, 70s, and beyond, this gentle, purposeful movement can make a remarkable difference in your overall health, especially for your heart, blood pressure, and even your mood. Brisk walking isn't just about putting one foot in front of the other. It's about moving with intent, picking up the pace just enough to get your heart beating a little faster while still allowing you to carry on a conversation. It's not a race. It's a rhythm, a steady, sustainable rhythm that signals to your body, let's stay strong. As we age, our cardiovascular system, our heart and blood vessels, naturally go through changes. Blood vessels may stiffen, blood pressure may rise, and our heart might have to work harder to do the same tasks it once did with ease. That's where brisk walking comes in. It gently challenges the heart, helping it stay efficient, flexible, and resilient. In fact, research shows that just 30 minutes of brisk walking 5 days a week can reduce systolic blood pressure, the top number, by as much as 8 to 10 points over time. That's the kind of improvement that can help you avoid extra medication, reduce doctor visits, and most importantly, help you feel more like yourself again. But the benefits go beyond blood pressure. Many people don't realize that stress, especially the kind we carry silently, can be just as dangerous to the heart as poor diet or a lack of movement. Walking, especially outdoors, gives your mind a place to breathe. It clears mental clutter, lowers stress hormones, and gives you a few precious moments of peace in your day. Whether you're walking around the block, in a park, or even inside a shopping mall, the simple act of walking at steady pace helps calm your nervous system, lowering the constant buzz that keeps blood pressure elevated even when you're not moving. Here's something even more powerful. Walking becomes even more effective when done with someone else. Maybe it's your spouse, a neighbor, or even your dog. Walking together doesn't just make the time pass more quickly, it brings in connection. And connection, especially in later life, is a powerful form of healing. Loneliness has been linked to higher blood pressure and increased heart risk. But walking with someone you enjoy spending time with, that's heart medicine in motion. Take Harold, a 78-year-old viewer from Minnesota. He wrote to us not long ago to share how he started walking each morning after breakfast. At first, he said, my legs ached. I didn't think it would do anything. But within 2 weeks, Harold wasn't as tired standing up. His numbers were improving. His doctor noticed. He felt more alive. And that's the magic of consistency. It's not about speed. It's not about distance. It's about showing up every day. One walk at a time, you give your heart and body the message. I'm still in this. I'm still moving forward. Forget the gym. Forget expensive machines. Brisk walking requires no equipment, no membership, and no training. Just a good pair of shoes and a safe place to step. Start small. Even 10 minutes a day is enough to begin reaping the benefits. If you're not sure how to begin, try walking just to the end of your street and back, then a little farther next week. You get stronger by doing, not by waiting for the perfect time. So often we think of exercise in older age as a chore, a burden, or something that's just too hard. But brisk walking flips that script. It's simple, it's doable, and it's deeply effective. Every step you take is a vote for your health, your strength, and your independence. So here's a question for you. Are you ready to take that first step? Let us know in the comments what your walking routine looks like, or what's holding you back. Remember, it's never too late to start, and when you walk for your heart, your whole body thanks you. Exercise 2, seated marching. What if I told you that you could boost your heart health, circulation, and energy levels, all while sitting down? It might sound too easy, but it's true. Seated marching is one of the most effective and accessible exercises for older adults, especially those who may have limited mobility, joint pain, or concerns about balance. In this simple movement, we're not just exercising the legs, we're gently stimulating the cardiovascular system, improving blood flow, and reminding the heart that it's still got work to do in the best way possible. Seated marching is exactly what it sounds like. While sitting comfortably in a sturdy chair, you lift one knee, then the other, as if you're marching in place. Only your feet don't need to hit the ground. It's rhythmic, it's low impact, and most importantly, it's safe. You control the pace, you control the duration, and every time your leg rises, so does your commitment to better health. Just like brisk walking, seated marching gets the blood moving. That movement helps your heart beat a little stronger and keeps your arteries flexible. For older adults, regular seated movements like this can help reduce resting blood pressure, improve circulation to the legs and feet, lower the risk of blood clots, improve oxygen delivery to the brain, which supports memory and focus, and even help regulate blood sugar levels. What's more, because you're seated, the exercise is easy on the knees, hips, and spine, making it ideal for those with arthritis or chronic pain. Let's walk through it together. Find a sturdy chair, preferably one without wheels or arms that restrict your movement. Sit tall, feet flat on the floor, knees at a 90-degree angle. Rest your hands lightly on your thighs or the sides of the chair. Now, slowly lift one knee toward your chest as high as is comfortable. Then lower it back down. Repeat on the other side. Continue marching in this seated position, left, right, for about 30 seconds to 1 minute. Take a break, then try another round if you feel up to it. Go at your own pace. It's okay to start with just 10 to 15 seconds and build from there. Want to make it more fun? Try marching to your favorite upbeat song, or keep rhythm by clapping your hands. Many older adults tell us seated marching is how they start the day. Before breakfast, before medications, before the world gets too busy. Just a few minutes of movement in a quiet room can be all it takes to set a positive tone. It wakes up the body, lifts the spirits, and gives the heart a healthy push in the right direction. You might not think seated marching could have a big impact on how you feel, but ask anyone who's done it for a week, and they'll tell you it boosts confidence. It reminds you that you're still capable, still in control, still working with your body, not against it. And when we move our bodies, we often move our moods too. Studies show that low-impact exercise, even while sitting, can ease symptoms of anxiety and depression in older adults. It's not just exercise, it's empowerment. We recently heard from Rita, a 74-year-old widow from Ohio. She started seated marching exercise during the winter when it was too icy to walk outdoors. At first, she said, "I felt silly. Marching in my chair? What could that possibly do?" But after 2 weeks, she noticed her legs didn't feel as heavy. Her ankles weren't as swollen. And for the first time in months, she wasn't dreading getting out of bed. That's the power of small steps. Or in this case, small lifts. You don't have to stand to take a step forward in your health journey. Seated marching is proof that movement meets you where you are. Whether you're recovering from surgery, dealing with arthritis, or just need a break from standing activities, this exercise helps you keep going. So next time you're watching TV or chatting on the phone, try adding a little marching to the mix. Even 30 seconds a day can bring you closer to a stronger, healthier heart. You've got this, and your heart will thank you for every lift. Exercise 3, wall push-ups. Push-ups might bring to mind images of athletes or military drills. But did you know there's a gentler version designed just for you? Let us introduce wall push-ups, a powerful, low-impact way for older adults to build upper body strength, improve cardiovascular health, and feel more stable and independent in daily life. Best of all, there's no getting down on the floor. Just a clear wall, a few feet of space, and your commitment to better health. Wall push-ups are a modified version of the traditional push-up. Instead of lowering your body to the ground, you stand and push yourself away from a wall. This simple shift makes the movement more accessible while still engaging the chest, shoulders, arms, and core. It's more than just a muscle exercise. This controlled movement gets the heart rate gently elevated, helping to stimulate circulation and keep the cardiovascular system in check. Wall push-ups are about function and freedom. They help you build strength for everyday tasks like pushing open doors, lifting light groceries, or even getting up from a seated position. They encourage balance and coordination, reducing the risk of falls. And importantly, they offer a gentle cardiovascular boost, especially when done in a slow, rhythmic pattern over time. Plus, working the upper body improves posture, supports shoulder joints, and keeps the arms toned, which would be a nice confidence booster too. Let's take it one step at a time. Stand facing a wall about 2 to 3 feet away, depending on your comfort level. Place your hands flat on the wall, slightly wider than shoulder width at chest height. Step your feet back until your body is at a slight angle, keeping your heels on the ground. You should feel steady and supported, not straining. Bend your elbows slowly, lowering your chest toward the wall. Keep your body in a straight line from head to heel. Stop just before your nose touches the wall, then push back to your starting position. Try doing 8 to 10 repetitions, rest, and repeat for 1 to 3 sets, depending on your ability. As you get stronger, you can increase the difficulty by stepping further back from the wall or doing more reps. Don't forget to breathe. Inhale as you lower yourself toward the wall, and exhale as you push back. This rhythmic breathing supports your heart and helps you stay focused and calm during the movement. Here's something many people don't realize. Wall push-ups gently elevate the heart rate, especially when done at a steady pace. This makes them a great way to combine strength training with light cardiovascular exercise, 2 key ingredients for healthy aging. According to heart health guidelines, building muscle helps improve metabolic function, control blood sugar, and lower bad cholesterol. For older adults, it also helps with maintaining independence, reducing the need for assistance with daily tasks. Let's take Charles, 79, from Florida. After his mild stroke, his therapist recommended wall push-ups to rebuild strength in his arms and chest. At first, I could barely do 5, he recalls. But now I'm up to 20. I can lift my laundry basket again. I can help my wife with the groceries. I feel like myself again. That's what it's all about. Not perfection, progress. And that's something anyone can work toward, no matter their age. Unlike traditional floor push-ups, wall push-ups don't stress the wrists or back, require no special equipment, can be done in small spaces, even during TV commercial breaks. Build strength without creating soreness. Plus, they're easy to do in pairs. Grab a friend or loved one and make it a morning routine. Wall push-ups might not look like much at first glance, but don't underestimate them. They're a foundation builder, a confidence restorer, a way to tell your body, I still care. I'm still capable. You don't need to be a bodybuilder or go to a gym. Just find a wall, stand tall, and press your way into strength and better heart health, 1 rep at a time. Small moves, big gains. You're building more than muscles. You're building momentum. Exercise 4, seated arm circles. You don't need to stand or lift weights to keep your heart and muscles active. Sometimes the smallest, most gentle movements bring the greatest rewards, especially when done with consistency and care. Seated arm circles are just that kind of movement. This exercise may look simple, but it's a wonderful way for older adults to promote shoulder flexibility, stimulate circulation, and give the heart a little lift. And because you're seated, it's incredibly safe, low impact, and easy to do anywhere, whether you're in your living room or the doctor's office. Let's be honest, many seniors experience stiff shoulders, reduced arm mobility, or even the occasional ache from doing daily chores. Add in a sedentary lifestyle or long hours of sitting, and it's no wonder that the upper body can feel tight and tired. This is where seated arm circles come in. They may look like a basic stretch, but when done with intentional movement and controlled breathing, they can help to improve shoulder joint mobility, strengthen the deltoid muscles and upper arms, enhance posture and range of motion, encourage blood flow to the upper body and gently raise heart rate, relieve tension in the neck and upper back. Best of all, they're easy to modify for different fitness levels and physical conditions. What you'll need: a sturdy chair with a back, no armrests if possible, and space around you. Sit up tall in your chair, feet flat on the floor, with your back straight and shoulders relaxed. Extend your arms out to the sides, parallel to the floor, palms facing down, like forming a T with your body. Begin making small forward circles with your arms, about the size of a teacup. Do this for 15 to 30 seconds, breathing steadily and keeping your shoulders down. Pause for a moment, then reverse direction. Make small backward circles for another 15 to 30 seconds. If you're feeling good, you can increase the size of the circles slightly or repeat the entire cycle 2 to 3 times. Remember to keep your movements controlled, not rushed. This isn't about speed, it's about building coordination, warmth, and endurance. You may not be running or jumping, but arm circles done in sequence increase blood circulation and engage the cardiovascular system, especially when combined with deep, paced breathing. That's why fitness experts often classify them as part of dynamic warm-up or a light aerobic routine. For older adults, that makes them an excellent daily habit, a form of microcardio that can wake up the body and strengthen the upper body all at once. Keep movements smooth and slow to avoid strain. If you have arthritis or shoulder pain, reduce the range of motion or do the circles one arm at a time. If you experience dizziness or shoulder discomfort, stop immediately and rest. Stay hydrated and perform the exercise in a cool, well-ventilated area. This exercise also makes a great warm-up before a walk or another home workout. One of the most overlooked benefits of this exercise: independence. Meet Grace, 73, who started doing seated arm circles during her morning TV routine. At first, it just felt like waving in slow motion, she laughs. But after a few weeks, I noticed I could reach behind me easier, and I didn't get as tired folding laundry. It's a small thing, but it made a big difference in how I feel. The beauty of seated arm circles is in their simplicity and safety. No need to stand, no pressure on the joints, no equipment required, no experience necessary, and yet the benefits stack up. Every circle you make is a reminder: movement is medicine. Even if you're dealing with joint stiffness, balance concerns, or energy limitations, you can still move. You can still thrive. Exercise 5, seated leg lifts. Leg strength plays a huge role in your overall health, especially as we age. Strong legs help you stay steady on your feet, move with confidence, and support your heart by improving circulation. Seated leg lifts are a simple yet powerful exercise that lets you build leg strength, boost blood flow, and protect your cardiovascular system, all while sitting comfortably in a chair. As we get older, many of us spend more time sitting, whether it's resting, watching TV, or working at a desk. But long periods of sitting can slow circulation in the legs, leading to swelling, fatigue, or even increasing the risk of blood clots. Seated leg lifts gently activate the large muscles in your thighs and hips, helping to pump blood back toward your heart. This action reduces swelling and heaviness in your legs, helps regulate blood pressure naturally, builds muscle endurance for everyday activities like walking and standing, supports better balance, and reduces fall risk. Even better, you don't have to stand or use weights to get these benefits. You can do leg lifts safely seated, making it perfect for anyone with mobility concerns or joint pain. What you'll need: a sturdy chair with a straight back and your favorite comfy shoes. Sit tall in your chair with your back straight, feet flat on the floor, and hands resting on your thighs or the chair for support. Slowly lift one leg straight out in front of you until your thigh is parallel to the floor or as high as comfortable. Hold the leg lifted for about 3 to 5 seconds while keeping your muscles engaged. Slowly lower your leg back down with control. Repeat with the other leg. Aim for 10 to 15 lifts per leg per session. If that feels too much, start with 5 and build up gradually. Because this exercise works your biggest leg muscles, your quadriceps and hip flexors. It has a direct impact on your heart's workload. Strong muscles assist in moving blood efficiently through your body, taking pressure off your heart and helping to keep your blood pressure steady. This movement also improves your muscle tone, making everyday activities easier, from climbing stairs to getting up from a low chair. As you lift your legs, focus on breathing deeply and steadily. Inhale as you prepare, exhale slowly as you lift and hold your leg. This breathing rhythm helps your nervous system stay calm, lowering stress hormones that can raise blood pressure. Remember, this exercise isn't about speed or repetitions alone. It's about control, breath, and consistency. I met John, 76, who told me he used to feel tired just getting up from his recliner. After adding seated leg lifts into his daily routine, he noticed his legs felt stronger and his walks were longer and less tiring. It's like giving my legs a little wake-up call every day, he said. His doctor even noticed improved circulation and recommended he keep it up. That's the kind of positive feedback that comes from consistent, gentle movement. Legs are the foundation of your mobility and independence. By strengthening your legs while sitting, you're not only helping your heart, but also building confidence to move more freely in your day-to-day life. This exercise complements the other movements we've talked about. It rounds out a heart-healthy routine that fits your lifestyle, no gym required. Final thoughts. Growing older doesn't mean giving up on your heart or your health. In fact, now's the perfect time to take care of the body that's carried you this far. These 5 simple exercises don't require equipment, a gym, or even much time. Just your body, your breath, and a little consistency. Start where you are. 1 walk, 1 squat, 1 wall push-up at a time. Your body will remember and reward you with steadier blood pressure, a calmer mind, and a heart that doesn't have to work overtime. Now it's your turn. How many of these exercises are you already doing? And which one will you start today? Share your thoughts in the comments. Your journey might just inspire someone else. If you found this video helpful, like, subscribe, and turn on notifications so you won't miss what's coming next. Your support means everything to us and helps us continue creating content that informs and uplifts. Thanks for being here, and we'll see you in the next one.